What to know before considering peptic ulcer surgery. If you or someone you know is dealing with peptic ulcers, you might wonder about the possibility of surgery. Before jumping into that decision, it's essential to know a few key points. Peptic ulcer surgery is usually considered only after all other treatments have been tried and when serious complications arise. Most peptic ulcers can heal with medications, lifestyle changes, and treating underlying causes like Helicobacter pylori infection. Surgery is typically reserved for severe cases where complications occur, such as uncontrolled bleeding, perforation, obstruction, or ulcers that do not respond to medical therapy. First, let's talk about when surgery is indicated. Surgery is often recommended for ulcers that cause life-threatening bleeding that cannot be managed with endoscopic treatment. It may also be necessary for perforated ulcers, which allow stomach contents to leak into the abdominal cavity. Another reason for surgery is gastric outlet obstruction, which can happen due to scarring or swelling from the ulcer. Lastly, refractory ulcers that do not heal despite optimal medical management may require surgical intervention. Now, what types of surgical procedures are available? Depending on the ulcer's location and the complications involved, surgery might include removing the ulcerated part of the stomach or duodenum, known as partial gastrectomy. Another option is vagotomy, which involves cutting parts of the vagus nerve to reduce acid secretion, often combined with drainage procedures. If there is a perforation, surgeons may use techniques like the Graham patch to repair it, or they may ligate bleeding vessels. In some cases, reconstruction procedures like Roux-en-Y may be performed to restore gastrointestinal continuity. Before any surgery, patients will undergo thorough evaluations. This includes diagnostic assessments like endoscopy, imaging, and tests for Helicobacter pylori. This preoperative evaluation is crucial to ensure that the patient is ready for surgery and helps the medical team plan the best surgical approach. It's also important to consider the risks and benefits of surgery. While surgery can be life-saving in emergencies, it does carry risks such as infection, bleeding, and complications related to anesthesia. However, with advances in medical therapy, the need for surgery has decreased significantly. Many patients experience positive recovery outcomes with proper care after surgery. Postoperative care is vital. After surgery, patients receive specialized care to monitor healing and manage nutrition. The remaining stomach tissue often adapts over time, and follow-up appointments are essential to check for recurrence or complications. Lastly, it's worth noting that due to effective medications like proton pump inhibitors and antibiotics for Helicobacter pylori, surgery is less common today. Most ulcers can heal with medication and lifestyle changes, such as avoiding non-steroidal anti-inflammatory drugs, quitting smoking, and making dietary adjustments. Surgery is generally a last resort when these measures fail or complications develop. In summary, before considering peptic ulcer surgery, it is crucial to understand that it is typically reserved for complicated or refractory cases after thorough medical treatment. Consulting with healthcare professionals is essential to ensure the best outcomes tailored to individual health needs.